Columbia University, finishing up my master's in public health and working there in a research capacity. Before, similar to Brent, I wanted to go back. I studied in South Africa, and I really wanted to return. So with a fellow global health minor, Jammer Bernard, we ended up going back to do research on the sport for development movement in South Africa, and where girls and women were fitting into that picture. And then I actually came back and worked with IPD, who's sponsoring this, on some of their global health education programs. And the whole time, which we were actually discussing before, there's a lot of public health jobs, but we realized we really couldn't enter the field until we had a master's degree. It seemed like it was one of those fields that you really do require more education. And so I guess I kind of gone the traditional public health route. And so I ended up starting at Columbia in 2010. And I'm in the program on forced migration and public health. When I was in Chicago before, I was also working with refugee resettlement, and Columbia was one of the unique programs that had an emphasis on refugee and complex emergencies. So I started there in 2010, and kind of through the process, I thought I was going to end up doing more program work, and got really interested in research, and started working in health systems research, which is kind of something I didn't expect, but opportunities came about. And since then, I ended up taking a job while in school, so it's taking me a little bit longer, but I'm working in health systems research in Tanzania and Ghana. So global health is definitely, piqued my interest. Right at Northwestern, I got really interested. It was a good foundation in terms of what was going on, but I kept wanting to learn more, especially in terms of evaluation, and so much that goes into that. I may continue on with studies too, just because I'm just starting. There's so much to build on it, and I don't think I would have actually probably been in this field had I not started at Northwestern. Global health was not even really on my radar. Public health wasn't. I didn't think I'd be in healthcare, coming from a family of clinicians. It didn't seem like something I would do, but bringing like a social side to health definitely fit. So.